They have not. And if you look at their map, they have failed to report anything in a lot of our rural communities. If you look at the map, have you seen the Big Island map? I just want to know, how are we going to get that data? Because this is our island. They're not reporting that. They have, maybe that's why HILO's numbers are big, because some people are getting tested, but no data is available in a lot of rural communities. And it's because they said, well, you guys get 1,000 people or less in those zip code areas, so we don't consider you guys anything. So those numbers gotta go somewhere. So when you tell me about Department of Health, I have no faith in them. So how are we planning to do a better map than Department of Health is putting out, so that we can truly know where those cases are? Because if you look at the map, and I'm sure you did, there's a lot of gray area. And those gray areas adds up to more, we may be just under 1,000. It may be 995 in one community, and they don't put the data out. But you add up all those communities, where are our numbers?
I was on the state ArcGIS dashboard earlier today, and it notes 992 total cases for our island, 736 released from isolation, 52 required hospitalization, and 18 deaths. But when I checked my civil defense message, my text from this morning, huge discrepancy. And so I think that the confusion and the anxiety and the stress that we are all stewing in stems from the fact that there isn't clear, simple, accurate, consistent information from all levels of government. And so it really erodes the trust that we have in people in government that we are expecting to kind of help us navigate this process. So my question is, what can we do to be more proactive in coordinating all levels of government with our messaging so that we can rebuild trust in our community?
In regards to conflict, in regards to data or difference in data, the one area that was of differences was the number of people who died. And we explained that also. And I really don't know how to correct it, because the department of the hospital would release information in regards to someone dying. So that's the information we use, what the hospital give to us. However, Department of Health officially cannot report a person who dying from that specific cause, like the COVID, until all the death records and confirmation by the doctors, et cetera, are received. And naturally, that is sometimes received not until days later. And so, the discussion is, if we hold back or we try to explain it, we're going to cause more confusion. And so we just explain it, why there is a difference. The Department of Health sometimes will wait until they get confirmation. We get, and if you listen to the messages, the message clearly state our information is from the HILO Medical Center on deaths.
The online kind of groups that are running a lot of these data collective sites, what they've been struggling with is everyone's basing on DOH numbers, and that's good. So we have a reliable source. But we're tracking 28 days of cumulative data that are plus cases, minus cases, cases released, and deaths. So that 28 days worth of data is incredibly hard for anyone to pick any real data out of. We have total number of cases, but 28 days worth of information makes it very hard to decipher what's happening immediately in our county. So if I was to offer any solution, would just be, if it's possible, if we could drop that from 28 days to 7 days or 14 days, we can start to see a very clear picture of what's evolving in our community as it's happening, and not try to go back and fine tune what information is coming out and the total cases minus what went out, minus what came in, especially when we start to reopen. So that's just my comment. I have more questions, but I think I'll save them for later when we talk about the actual travel. But as we go to reopen, if DOH is listening, I think we have DOH in the room too today, can we please have a shorter version of time, a shorter amount of time that we track data in so we can actually make good calls going forward. If we can see cases blowing up in Kona or per zip code, then we can react better than seeing 28 days worth of data and trying to estimate how many cases went out and how many cases came in to the same zip code. It's just, it's easier for us to get a grip on cases that are happening now. So that would be a solution for what we're talking about. And thank you for coming up, Eric. And I don't want to get too deep into this. I just, from everything I've seen so far, is the numbers that we track are 28 days worth of information. Is that right?
So just to clarify, you're talking about the map that's on the DOH's dashboard.
Yeah, the zip code maps.
The zip code cases
Yeah.
broken up. Yeah, it is by 28 days. I don't know exactly why it's 28 days, but I can bring that issue up and concern and see why it's 28 days.
Yeah, and I think what Val touched on earlier was when we have some zip codes that are not being touched because there are 1,000 residents or less in that area. So they say no data available versus 0 cases, which is confusing. A lot of questions on my Facebook and my social media pages. But more so, a lot of the guys who are doing statistics, not guys, but people who are doing statistics and running numbers and using our DOH data are frustrated because they can't make any real-time decisions because you're seeing a 28-day block of information, but trying to figure out where the new cases are. You see plus cases in HILO and Kona right now, even KL, but it's hard to decipher what number actually happened like yesterday because it's minus cases that were released, any deaths, and incoming cases all grouped in the one number per zip code. And that's really hard. I mean, if you think about it, how can you pull a good number of what happened yesterday? And I'm just going to say this is historical data we use too, because the results that we get are 3 days post-testing. Yeah, 'cause that's our lag time.
24 to 48 hours. Right now.
Yeah, or a little bit longer. That's the best case. Yeah, 24, 48.
Currently, yeah,
Yeah.
48 hours.
Okay, so with that in mind, just if you can run that by some of the uppers and say, look, if we had better information, reopening may not be so daunting because we can actually see real time what's happening per zip code across the island, which allows residents to make their decisions going forward.
I think one thing to clarify too is that the location of these cases are based on their residence. It doesn't specifically relate to place of exposure.
Yep. Okay, yeah, thank you.
But I'll follow up.
Thank you, sir.
Okay.
Okay. Thank you.